Cancer is a disease characterized by the development of abnormal cells that could divide uncontrollably and have the ability to infiltrate and destroy normal body tissues. It is a major public health and economic issue. With over 18 million cases in 2018, it is estimated that 29 million cases may be expected by 2040 due to the aging and growth of the population. Worldwide, there were an estimated 18.1 million cases and 9.6 million cancer deaths in 2018, with 1 in 4 men and 1 in 5 women developing the disease, while 1 in 8 men and 1 in 11 women dying from it. Record also shows half of the new cancer cases and cancer deaths in the world occur in Asia. In Nigeria, Global Can records show cancer killed over 70,000 Nigerians last year, with about 124,000 cases reported. According to the data, Nigeria has already recorded over 10,000 new cancer cases in 2023 within 35 days into the year. Global Health Digest this week is focusing on the existing gaps in cancer awareness, prevention, and treatment. I am Uche Ugochukwu. Thanks for being a part of this program. We will continue in a moment after this background report.
Cancer is a generic term for a large group of diseases that can affect any part of the body. Other terms used are malignant tumors and neoplasms. One defining feature of cancer is the rapid creation of abnormal cells that grow beyond their usual boundaries and which can invade adjoining parts of the body and spread to other organs. The latter process is referred to as metastasis. Widespread metastases are the primary cause of death from cancer. Record shows each year approximately 400,000 children develop cancer. The most common cancers vary between countries. Cervical cancer is the most common in 23 countries. Cancer may have been discovered and written about thousands of years ago. However, the disease itself has actually existed before the evolution of humans. It was first documented in Egypt about 5,000 years ago. Since that time, people from cultures all over the world have written about the disease and its potential treatments. The advances in treatments have succeeded in bringing about a decrease in cancer deaths, though many in developed countries. Indeed, cancer remains a major cause of sickness and death throughout the world. In Nigeria, cancer leads to over 72,000 deaths per annum for male and 40,647 for female. This number is set to increase given that there are 102,000 new cases of cancer every year. The estimated incidence for breast cancer is 27%, cervix uterine 14%, liver 12%, prostate 12%, and colorectal 4.1%. While estimated mortality for breast cancer is 20%, liver 16%, prostate 13%, cervix uterine 12%, and colorectal 4.4%. Breast cancer is now the leading cancer death in Nigeria, while liver cancer is the second and prostate cancer is the third. And over 70% of the cancer patients present late stages 3 and 4, with few patients having access to the limited treatment facilities. Experts say tobacco use, alcohol consumption, unhealthy diet, physical inactivity, and air pollution are risk factors for cancer and other non-communicable diseases. This is a particular issue in low and middle-income countries. Approximately 13% of cancers diagnosed in 2018 globally were attributed to carcinogenic infections, including Helicobacter pylori, human papillomavirus, hepatitis B virus, hepatitis C virus, and Epstein-Barr virus. Hepatitis B and C viruses are some types of HPV, increasing the risk for liver and cervical cancer. Infection with HIV increases the risk of developing cervical cancer sixfold and substantially increases the risk of developing selected cancers.
You're welcome back. We also went to the streets to sample opinion about this genetic disease.
Well, I don't know know much about cancer, but I know it's a very dangerous disease. It kills.
Cancer is a deadly disease to say, but if noticed on time and tackled on time, it can be get rid of. It can be taken care of without causing death.
The not being aware is another risk factor.
Some people use certain type of body lotions, and they actually come across skin cancer.
I have the experience. I don't want to be even speaking about cancer because I've seen what he has done to my late wife. You understand me? So one thing about the cancer is a very deadly disease, which even need the government attention.
What else can I say? As part of efforts to increase cancer care in the country, the federal government recently inaugurated brachytherapy machines in 5 tertiary hospitals in Abuja to aid diagnosis and treatment of cancer through radiotherapy. Brachytherapy is a type of internal treatment which uses radiation to destroy detected cancer cells and shrink tumors. The Minister of Health, Dr. Osage Ehanire, at the inauguration said the Ministry of Health would continue to increase access to cancer care services, especially diagnosis, chemotherapy and radiotherapy services. To speak more on this intervention and other efforts to ensure access to cancer treatment and care in Nigeria is the President of the Nigeria Cancer Society, Dr. Adamu Alhassan Umar. He said the situation on ground is worse than the estimated statistics.
Well, thank you very much for having me on this program. Well, I think recording over 10,000 new cases of cancer in the first quarter of the year, basically in 1 month, in just 33 days, well, it will be a good omen to some of us in the cancer advocacy space, because that is actually an indication that there is now an increase in the number of cases, in the number of patients that come forward for screening. You know, there is an increase in the way people assess care. You know, unlike before, that you discover that out of every 1 patient that comes to the hospital that is diagnosed of cancer, you have over 100,000, if not more, that are out there undiagnosed because they haven't gotten the means to come to the hospital, or they don't know because of lack of awareness. So recording 10,000 cases in 1 month is not actually very scary, but indeed, again, it is scary because when you look at the population of Nigeria, even these 10,000 new cases that are recorded, according to this report from the International Agency for Research in Cancer, may be an underestimation. And that is the reason why we pray and hope that people will come forward for early screening, because that is the panacea towards adequate treatment, because prevention, first of all, is better than cure, and then early detection is equally a very key ingredient. So if people come early, you have cancers that are detected at the very early stages, and of course, when cancers are detected at very early stages, most of them are curable. So yes, we are continuing with the fight to create the awareness, and of course to encourage and government to create an enabling environment for people to access care, so that routine screening can be done at the level of the grassroots. Actually, for most cancers, prevention is the key word, because 1/3 of most cancers, that's like 30% of most cancers are curable. Again, another 1/3, which is another 30%, is treatable when detected early. You know, the problem with most cancers, particularly the common cancers that we have in our environment, not only peculiar to Nigeria, but indeed all over the world. When you talk about breast cancer, you talk about cervical cancer, and then you talk about prostate cancer in men. Be mindful that 1% of men also develop breast cancer. So these 3 common cancers are mostly preventable. Now, when they report early to the hospital, you have cancers that are picked at a very early stages that they have not gone elsewhere. But usually what we have in Nigeria are presentations that are usually very late. You have people presenting at stage 4. You know, cancers have already gone to other areas of the body, and that makes it very difficult to control. And that is usually the leading cause of mortality in our country, Nigeria. Well, yes, I can say we are on the right track and we are making some progress, but as a country, our progress is still not good enough. Nigeria is one of the signatories of the African Union Declaration that took place here in Abuja in the year 2001, where all African countries agreed to commit at least 15% of their consolidated budget to health care. And Nigeria has been battling between 5 to 7%, in some instances, in some years, 4-point-something% of total budgetary allocation to healthcare. And without the proper adequate budgetary provision to healthcare, there is no way we can address universal health coverage. There is no way we can provide care, not only for cancer, but indeed for all other ailments to the teeming populace of Nigeria. Yes, Nigeria is making some progress. Another milestone Nigeria has achieved is the recent implementation of the act that was signed into law in the year 2017 by this administration. That is the act establishing the National Institute for Cancer Research and Treatment. This is the first national institution for cancer research and treatment that we have in Nigeria. And that will definitely go a long way in entrenching the culture of research, in entrenching the culture of data collection, centralized data collection, so that we can have a purposeful drive at addressing the major gaps that exist in cancer care. And amongst other several things. And if, in fact, again, the Cancer Health Fund. The Cancer Health Fund is a fund that was established by the federal government to cater for indigent cancer patients that cannot afford to pay for care out of their pockets. And 3 cancers, cervical cancer, breast cancer, and prostate cancer were earmarked, and 6 pilot hospitals selected across the country. And at the recent ministerial press briefing, it was also announced that an additional number of hospitals will be introduced into the scheme, and of course, again, additional cancers, particularly childhood cancers, will be introduced into the scheme. Another major achievement is the Cancer Access Program that the federal government operates, where those that can afford to pay for care to some extent will pay 50%, and federal government and their partners will pay the remaining 50% to access care. And the Minister of Health also announced at that ministerial press briefing that they are now increasing from 20 centers across the country to all federal tertiary health institutions in the country. And that is actually some good news to us in the cancer advocacy space. And we will continue to push and encourage government to do more. We will continue to push for complete care for cancer, because cancer treatment is a very expensive venture. Not only to the poor, even to the rich, cancer is very expensive to treat, and everybody must we must all come together so that we can have a united front through our actions and our voices, so that we can address the cancer care gaps that we have in the country.
What is the situation in other countries? Melanie Sampson Said of the Union for International Cancer Control joined us via Zoom from their headquarters in Geneva, Switzerland.
Here, there is really a margin of progression, and we have big initiatives within WHO for some cancers where you can really make a difference. So the global strategy for the elimination of cervical cancer, also the global breast cancer initiative, and the global childhood cancer initiative. So really for these cancers, from a public health perspective, at UICC, we're raising awareness, we're doing global advocacy. I come from the team here that is doing capacity building, so at the regional level and country level, to help everyone make a difference. So first of all, I would say between WHO is saying 30% of cancers can be prevented. So it's also a question of public health. There are, first of all, the infectious cancers. There are some cancers that are due to HPV. I mentioned cervical cancer. So HPV vaccinations, for example, and HBV, hepatitis B. So now you have the vaccine in routine for the kids. So if you're not vaccinated and you have HBV, it can lead to liver cancer. So some of the infectious, I would say, cancers can be prevented through vaccination and also early detection. You should like have in mind that these are like a lot of different cancers. So breast cancer, for example, you can do a lot of self examination, and they are like very innovative campaigns, awareness campaigns. Like one of our members, they do the Know Your Lemons. So it could be a lump and women should be like aware, like, oh, they shouldn't be afraid. So I'm feeling something, and I should go see my daughter, my daughter to check on this. And if detected early, there is a lot to do. Many of these cancers, for childhood cancer, if you detect it early and you have access to the right drugs at the right time, timely access to medicines, it's 90% survival rate most of the time. So if you're having really the capacities, it's one of the cancers where you can really make a difference. If, for example, you have like really a process to inform pediatrician about the symptoms that they could see, and if they can refer the kids, like really timely referrals to centers where they have access to the right drugs, this is something that really like you can treat, and children should have definitely access. It's a question of human rights also, children's rights. COVID created like a disruption at a lot of levels. I speak from here also. We had the experience that everything was closing. And what I heard from like the cancer patients all over the world is that they didn't have access to the hospitals anymore. They felt scared to go to the hospital. And also like they didn't have the same, so that all intervention like procedures that were like scheduled, they had to postpone almost for a year sometimes. So can you imagine like the missed opportunity to treat a cancer? Because cancer, it's like a time bomb. So you need to go quick in order to treat it. And it's really like a missed chances from these patients. But what is like really the impact we'll see now is really, I would say like the lack of screening. Because during like in many like instances in many countries worldwide, and it's still like in a few countries, people didn't go to their like screening. So it was not like the priority, including for hospitals. So can you imagine like how many people missed opportunities, missed chances to treat early? Really, there were like all over the world, and really the backlog, we will see the increase in terms of cancers that will be discovered at a later stage then. So we'll need to see in the epidemiology how this translate. So now UICC is doing a lot of advocacy, and all the world is working now on the pandemic treaty, emergency preparedness, to make sure that there is a continuity even if a pandemic happens.
You have heard from experts. Early detection remains the best. Please go for cancer screening. It is treatable if diagnosed early. A little show of love to a cancer patient could go a long way in the healing process. Salome Agalo is a Kenyan who is a 3-time cancer survivor. Salome decided to share her story with us with the hope of inspiring and encouraging someone who may be losing hope on life.
My journey started in the year 2007. There was a screening that we were told to go as employees in the office. And I did not have any symptoms of anything. So it was just normal checkup. But when I went for the pap smear screening, I was called after a few days to go back to the hospital that they had seen some abnormal cells. So further tests revealed that I had cervical cancer, and it was already in stage 2. So because I had history of HIV, the doctor said that they needed to do a quick intervention because it was the type of cancer that was going to spread. So I went through what is called total hysterectomy. It was very traumatizing for me because from HIV I had already lost 2 of my babies, and going through total hysterectomy meant that I was not going to have babies at all. So it was not an easy decision for me to make, but anyway, we signed the consent together with my husband and the surgery was done. After 2 months, of course, as anyone else, I went for a second opinion, third opinion, and then finally I decided to make the decision. So after the surgery, I think it dawned to my husband that he could not live with a woman who could not give children. So that way stigma started immediately and he left me, and I was all alone. But I thank God for the family that I have and my employer who took care of me and made sure that I was comfortable, and also through the treatment. I was treated, but unfortunately I got cancer again after 3 years, now this time in the colon. And so my colon was removed, part of my colon was removed, the cancer continued spreading and it also went to the rectum. And so I use a special appliance called a colostomy bag because I cannot pass stool normally. But I'm here today, after all these years, saying that there is survivorship even after cancer diagnosis. When it comes to cervical cancer, there's no information, or the information that is out there is not right. So women think that it is a painful thing to go for the screening, so some of them don't go. And also, stripping yourself naked in front of a stranger is also another thing. So you find that a lot of women are not going for that type of screening. If people who have gone through cancer like me and others can be trained to share our stories, and also to empower us with correct information, so that when we are going out there in the community, we're able to give information, the correct information, so that the myths and misconceptions are not there, so that when people go for the screening, they know exactly what to expect. As I go around in the communities, women say that before they were diagnosed with cervical cancer, some of the signs they were seeing is that they were having bleeding or abnormal discharge, or just pain maybe after sexual intercourse. So those are some of the signs, but let us not wait for those. Let us just go for the screening early. For colon cancer also, a lot of people say they'll be treated for ulcers, H. pylori. Some say they've been treated for typhoid for so many times and there's no improvement. So I'm urging people to not wait, but seek further advice from your doctor so that you can know early. I survived, and I believe that many other people can survive. And if you're there and you've been found to be having cancer, please don't give up. Let's keep hope alive. What has really encouraged me is joining support groups and meeting other people who have gone through the same and sharing our journey together. But I also urge governments to continue doing research on cancer, and especially the treatment.
I'm sure you have learned 1 or 2 things from Salome hearing these words. You have cancer. The fear that sets in almost immediately is overpowering, even for the strongest of persons. We have come to the end of this episode. See you next week on another disease burden. I am Uche Ugochukwu. I leave you with these tidbits, and don't forget, your health is your responsibility. Bye.